Hello, everyone. Welcome back to the Hues of Beauty podcast. It's Dr. D, your host. And today I'm just sitting here in my office having a little bit of coffee. And I wanted to talk to you guys about how to create a skincare routine, especially as a person of color. So I'm going to attempt to do this in 20 to 30 minutes because I like to put myself under pressure so that I can get things done. And so I'm going to try to film a podcast in the morning before work, just like a way to warm up before seeing patients in the office. So bear with me. All right. So most people, whenever they come into the office to see me, they usually ask me this question about skincare routines. They have so many products, or they don't know where to start. And so I figured it would be a good foundation to at least know how to create a skincare routine, because your skincare routine, in addition to your lifestyle, so what you eat and all of that, will really determine how your skin is going to look as you get older or as you are now. So we'll talk about the basics of a routine. We will also talk about different considerations. So, depending on where you are age wise, what you might need and what you may not need. And I'll also talk about some of the things that you need to consider based on your ethnicity or different combinations of ethnic groups. So, let's begin. All right. So, first things first, skincare routines. All right. Let's simplify it. There are 3 or 4 major steps in a skincare routine. So the most important thing in skincare, it depends on who you talk to, but you want to be able to clean your skin. So cleansing your skin is one step. The next step is moisturizing your skin or hydrating your skin. That's very important. And then the last step that's very important as well is protecting your skin. Okay. And so those are like the most important things that you need to have in your skincare routine. Now, there is a treatment step, but usually that will vary depending on if you have something to treat or if you're trying to prevent something, for example. Okay. So let's start with when you're in your teenage years or 0 to 9, because some people start having their periods around 9. So 0 to 9, most kids, they have beautiful skin, no blemishes, nothing's going on. They don't need to do anything. Okay. Just water is good when they're outside. Um, Sunscreen daily will be a good place to start. But really, when you're a little bit kid, you don't need much, right? Your skin isn't changing significantly. Now, next step is when you become a teenager. Okay, so your hormones come in place and you start to have surges of estrogen, testosterone, progesterone. And so the hormonal changes will make you much more oily. So you're going to have overactivity of your sebaceous glands. And this is where acne usually pops up. Okay, so if acne is not an issue, well, this is where keeping your skin clean becomes a challenge, right? Because before you were not really paying attention to your skin, none of that. And then all of a sudden, maybe you're experimenting with makeup as a tween, right? And now your skin is much more oily. And so then oil plus makeup will then lead to bacteria growing in this beautiful fertile place for the bacteria to grow. And then that leads to acne. Okay. So for teenagers, the simple routine is getting your skin clean. Like, you don't necessarily need to start treating the acne per se, but the biggest hurdle is getting them to consistently clean their skin. If they're doing sports, they need to clean their skin. It's not just their face, but like they need to shower and all of that, because a lot of things can happen when there's a lot of sweat left over on your body, right? So for the teenagers, most important thing, morning routine, you want to clean your face, and you don't necessarily have to use a cleanser in the morning. I recommend using cleansers more at night because it's the end of the day. Your skin has been through a lot. But in the morning, you can just cleanse your skin with some water, and then you go ahead and put some moisturizer on. Now, at this age, you might be a bit oily or prone to acne, so you might want to look for a lightweight moisturizer um, to help hydrate your skin. Because again, a mistake that a lot of people make is they think that if they're oily, they don't need a moisturizer, which is not true. And so you end up with people who have oily skin, but it's dehydrated, and that actually leads to more blemishes. Okay. So skincare routine in the morning, wash your face, use a moisturizer, and use sunscreen. We need to get in the habit of using sunscreen as early as possible so we can decrease any signs of aging down the line in the future. Okay. And then your evening routine is pretty similar. You cleanse your skin and you moisturize your skin and you go to bed. Okay. So that's your skincare routine if you're in your teenage years. All right. Now, when you come into your 20s, 25-ish, you start to lose you start to lose volume in your skin. Okay. Um, for a lot of people of color, this is not the case, but for some people, depending on like your ethnicity or if you're a combination of different ethnic groups, then you might be prone to starting to have volume loss and wrinkling early. Okay. So in that situation, then actually, let me circle back. Okay. We were talking about acne. So we talked about a skincare routine where you're just doing cleanser, moisturizer, and sunscreen. However, if you have acne, then this is a good time to start using what we call retinoids or retinol, for example. So the most common one that you can find over the counter is the different gel or adapalene gel. So where do you put this in your skincare routine? This will be used at night. Okay, and this is primarily used for the treatment of acne. So you would cleanse your skin, wait for your skin to get dry. This is very important. And then you would use a pea-sized amount of this medication, different gel, adapalene gel, on your face. And once it has been absorbed into your face, so wait like 20 minutes, then you put your moisturizer on. Retinoids have a tendency to make you dry. And so it's really going to be important to make sure that you're using a moisturizer, a good moisturizer, when you decide to start adding retinols to your skincare routine or retinoids. Okay. And the reason why I advise you to start using retinoids early on is because if you have skin of color, so let's say, for example, you have black skin. Black skin tends to develop post-inflammatory hyperpigmentation, so increased pigmentation in the presence of inflammation. Acne will be the inflammation in this case. And so you want to definitely try to manage any sort of inflammation on your skin so you don't end up having dark spots on your skin, which takes a long time and is more complicated to treat later on down the line. Okay, if you have an Asian skin type, then your problem is not necessarily going to be pigmentation, but it's going to be acne scarring. And you guys tend to get a lot of complex acne scars. So if you have an Asian skin type, again, it's going to be extremely important to make sure that you use a retinoid. Make sure that you use a retinoid to help with this acne. If the retinoid that you're using, like adapalene, which is the strongest version over the counter in the United States, if that version is not doing the trick for you, then at that point, it might be a good idea to see a doctor, dermatologist, skin doctor, to discuss other options because you might just need stronger versions of the medications to help manage your acne. Because one of the reasons why we are very aggressive with acne, especially at a younger age, is because we're trying to prevent the complications that can come from it, be it hyperpigmentation and or scarring. And those things tend to cause a huge such psychological impact on a lot of people. And so we're trying to prevent this early on and get you in the habit of knowing what to do. Because guess what? If you're a woman and you have your periods, the acne is not going anywhere. So let's roll into the 20s and 30s, okay? So 20s and 30s, this is usually when you start to have more signs of aging. That's when you start to lose volume in your skin. For some people who may have thinner skin, they might start to notice wrinkles. And so this is where the anti-aging component of things will really kick in, and when you need to start doing things to help prevent signs of aging. Okay. And in this case, signs of aging will be increased pigmentation, wrinkles, and volume loss. Okay. So let's go back to your skincare routine, 20s and 30s. Your skincare routine will be in the morning, you cleanse your skin. Now, you might have to add a treatment step in between. So the most common treatment step that people use is a vitamin C serum right after they've cleansed their skin. Vitamin C is great because it is an antioxidant, which means it's protecting you, for example, from the sun. And it helps to prevent free radical damage. So the sun causes UV damage, which destroys your DNA, and so it's going to help to prevent that. So it's really important to wear it, especially in the morning, because it works really well with your sunscreen. Okay. So morning routine, 20 to 30. You want to use something like a cleanser in the morning. You can use a vitamin C, or you can use some other treatment step if there's something going on. If you have pigmentation, you might want to use a serum that contains niacinamide or alpha arbutin or kojic acid. These are all things that help with pigmentation, which is, again, something that we see as we get older. And then after that, you want to use a moisturizer and sunscreen again. So sunscreen is super important. I can do a separate podcast episode just talking about sunscreen and the importance of it, especially in skin of color. Okay. Nighttime routine, this is where you're going to be using your cleanser. At night, this is where I really say use a retinol at night. If your skin is not having any issues with retinol, to me, there's no reason why you shouldn't use it. So use a retinol at night, and then afterwards you moisturize. So again, 20s to 30s, morning, cleanse, treat with a vitamin C or some other treatment step that will not have any issues with the sun. So kojic acid, alpha arbutin, niacinamide. Sometimes your moisturizers might have this. So really get to learn a little bit about different ingredients, and then I can also help guide you through that process. But again, morning routine, cleanser, moisturizer, cleanser, treatment steps, so vitamin C, moisturizer, and then sunscreen, and then evening, cleanser, wait for your skin to get dry, treatment step, retinol, retinoids, maybe something for pigmentation again, and then sunscreen, and then moisturizer. You don't need sunscreen at night, okay? Now, the 20s and 30s is really interesting because this is also a time when a lot of women are having children. Okay. And this is very personal for me because I was one of those people who I never knew anything about skincare prior to getting into the skincare industry. I know that's crazy, but when I was in medical school, all I learned was that I needed to wear sunscreen. Now, mind you, I am not a dermatologist. I trained in internal medicine and then eventually got into aesthetics. So I had a lot to learn. All right. And so I didn't start having skincare issues until I had my first child, which was at 30. And so during this time, the skin goes through a lot. Okay. One of the things that you have to remember is that, for some women, so two things usually happen when they're pregnant. They have an estrogen surge because this is important for protecting the baby and being able to have a baby. So you hear a lot of women have this pregnancy glow, right? Their skin looks beautiful, all of that good stuff. For some people, it's the opposite. They get like the mask of pregnancy, right? They have really darkening of the skin. They might have like a widening of their nose. They might have like their legs are going to get swollen, all of that. So a lot happens during pregnancy. And I can do a separate video talking about what is safe to use in pregnancy because retinoids, for example, cannot be used during pregnancy. So this is one of those times when you're going to have to pause on the retinol and keep your skincare routine as simple as possible. But I want to touch on the postpartum phase because I think this is the most problematic stage, at least it was for me. Okay. So when you're postpartum, you're in a state of pseudomenopause. Basically, what that means is that your estrogen just went from being super high to manage a pregnancy, and then now it's going to tank because now you're not pregnant anymore, and now you're breastfeeding, right? And so if you're going through a state of pseudomenopause, then everything is going to be dry. Okay, your skin is going to be dry. Your skin might get cracked, everything. Your skin, your vagina, like all things that are supposed to be moist will be dry. Okay, this is really important. And so the reason I bring this up is because it's going to be really important to really use a good moisturizer. This is the time when if you can moisturize 3 times a day, moisturize 3 times a day because your skin is just going to be going through a lot. It's trying to go back to where it was. There's so many hormonal changes. You might also at this time notice that mask of pregnancy isn't quite going away. So for some people, if you're not wearing a lot of sun protection and staying out of the heat, then you might develop melasma. Okay. And melasma is a chronic condition that is extremely difficult to treat. So one of the things I tell patients when they're pregnant is like sunscreen, 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 especially after you've given birth, like keep that. That will be the mainstay to prevent something like melasma from coming on board. But if it does happen, we do have treatment options. It's just that you will need more treatments consistently versus somebody who may have a problem and then we treat it and all they have to do is kind of like maintain the problem. Okay. All right. So now let's talk about 30s and 40s. So I mentioned the pseudo menopause. If you are one of those people who has many children, so during your 30s, for example, you will have multiple stages of pseudo menopause while you're breastfeeding or while you're going through the postpartum phase. So this stage, I believe, again, moisturizers are going to be extremely important. And then peptides are also really good for helping with keeping the skin, they really help with let me try that again. Peptides in your skin, so copper peptide, for example, will be really good again for protecting your skin, fortifying your skin, helping to build collagen and elastin. Because again, starting 25 plus, we start to lose our collagen and elastin. And so you want to use some skincare ingredients that are going to help to build that up. Okay. We can talk about that later. It's not an essential thing. So if you started in your 20s and then you took breaks during your pregnancies, then of course you're going to experience some signs of aging, not just because you stopped the retinoids, but also because you went through the pseudo menopause stage. And but it's going to be important for you to get back on it to basically get your skincare back, get your skin back into the routine of consistently shedding, right? So retinols, the way they work is that they work by exfoliating the skin. And so it's going to remove, top layers of the skin. And it's kind of like exercise for your skin. So it's removing a little bit. It's like working your skin out slowly and slowly and slowly. 30s is also a good time to add other exfoliating things like acids. Okay. I didn't mention acids in the 20s section, which can be used for acne. I'll do a separate video or podcast talking about acids. But in your 30s and 40s, I think that this is where acids come into play. So the most common one is going to be like glycolic acid at small percentages. So I love to ask my older patients, so 30 plus patients, to use a cleanser that contains glycolic acid. So I think Oil of Olay has one. It's like a 3.5% glycolic acid wash. And so using a glycolic acid is going to, again, help with exfoliating the skin in a controlled way. It works differently from a retinoid, but it's going to be the thing that's going to help give you that glowing skin. And the reason why you are going to now need two exfoliating products versus one is that as you get older, the rate at which your skin is going to shed is going to slow down. And so now your skin is having a hard time getting rid of the dead skin, and it gives you that very dull look, right? Your skin just doesn't look right. It just looks tired, And so in order to not have dull skin, you then need to make sure you're exfoliating properly. And so this is where acids are going to come into play. You can use a glycolic acid. I always recommend you can use it 2 times a week max. If glycolic isn't the option for you, you can also use a lactic acid serum. You can use a combination of AHA, BHA, for example, so salicylic and some AHA like glycolic or lactic. You can also use a mandelic acid. These are all AHAs and BHA that help with exfoliating the skin, and it's the thing that's going to give you the glow, right? And then the retinoid you can use other times. So let's go over an anti-aging skincare routine in your 30s and 40s and 50s, honestly. You cleanse your skin in the morning. Then you use a vitamin C serum, for example, if you can tolerate it. Not everyone can. Or you use some other serum that's not going to be irritating to your skin. So maybe something with niacinamide, or maybe something for pigment with kojic acid, or something with alpha albumin. So look for serums that have these products, that have these ingredients, and use those. Then you moisturize, and then you use sunscreen. Okay, so that's your routine in the morning. In the evening, you're cleansing again. You're using a serum for exfoliation. So AHAs and BHAs, I recommend no more than 2 times a week because you don't want to irritate your skin. So you can use your glycolic acid serum 2 times a week. And then on the other days when you're not using your glycolic serum, you can use your retinoids 4 times a week. I always recommend having one day where you're not using any actives on your skin because, just like when you exercise, some days you need to rest. Your skin needs a break from all of these activities or active ingredients. So you definitely want to take a break from using actives as well in your skincare routine. So evening routine is cleanser, use a treatment step. It could be a retinoid or an acid, and then moisturize. Okay. Again, moisturizer is so important because at this stage, like I said, you don't only have to go through stages of pseudo menopause, but even if you're not having any kids at this stage, at the 30s plus stage, your estrogen levels will start to drop. So even if you're not having kids in your 30s, your estrogen levels actually starts to drop around 30s plus. Okay. So you will still start to notice that your skin is getting drier and drier. So again, it's not even a negotiation. Once you hit your 30s, don't skip on the moisturizer. Once you hit menopause, then you really are having to deal with super, super duper dry skin. And so again, 3 times a day, I would recommend moisturizing your skin. So again, skincare routine 40 plus, it's going to be cleanse in the morning, use something to treat after that, moisturize, and then sunscreen. And in the evening, cleanse again, use a treatment step. It could be a retinoid or an acid, and then moisturize. If you find that the moisturizer is not sticking to your skin, like you're moisturizing and you still feel like you're dry, this might be a good time to add an oil or an occlusive product on top of it. So let's say you moisturize at night, you can use a little bit of Vaseline and put that on top of your moisturizer. And so that's going to act as an occlusive product where it's going to prevent the moisture from evaporating from your skin, so your skin will stay moisturized. So this is a tip, and I use this a lot during the winter time, but it's also something that as you get older, you might need to add to your skincare routine. So that is the basis of a skincare routine. Now, I mentioned a little bit about different ethnic groups and what you need to think about. So for people who are Black, for example, or of African descent, our biggest problem when it comes to our skin, first is pigmentation. So decreasing inflammation on the skin will be important. So that's why I want you to start treating your acne a bit aggressively. If you start having acne in your teen years, start using a retinoid. That's going to be really important. And the importance of cleaning your skin at that age, because if you keep your skin clean, it's going to decrease the chances of you getting acne. And then if you get acne and you use a retinoid, just use it and continue to use it. Because guess what? Every time you have a menstrual cycle, you're probably going to have a few spots, right? And so that's not going to change until you hit menopause. So retinoids are probably going to have to stay in your skincare routine till that time. Okay. And then once you get to your 40s and 50s, well, you don't want to stop it because you want your skin to look as young as possible. So that's just my tip for a lot of my patients who have color, who have Black skin. It's making sure that we try to prevent pigmentation with the use of retinoids, especially because acne is the most common reason why we get pigmentation on our faces. The second most common reason that we have pigmentation in our faces, at least in my office, is facial hair. I will do a completely separate topic on hirsutism and PCOS and how to have a skincare routine for that group. So pay attention and keep watching the videos or the podcast, and I will definitely go over that. And then the other group that we need to talk about are patients with Asian skin type. So a lot of times pigmentation is not a problem for Asian skin types, but scarring is a problem. Pigmentation becomes a problem later on, but early on, scarring from acne is a huge problem because they tend to develop atrophic scars, which include ice pick scars, box scars, things like that. So it's going to be so important for you to treat your acne. If you are not able to manage it with over-the-counter products, please see a physician so that we can prevent the complications that do come, because when it's now time to treat the complications, as a person of color, our options are limited. And when we want to do aggressive treatments, they come with side effects. So it's always great to prevent these problems before they come. So I'm going to end the video or the podcast here. I was trying to do this in a short time frame. If you have any questions, then please join the Delight MD Tribe Facebook group. And that is where I will be doing, I get a lot of people asking me questions there, and they're my inspiration for creating these podcasts. Also in the group, I plan to start going live every Tuesday where I will talk about topics, kind of like introduction to different things. So definitely go on the Facebook group and join and ask your questions. And I will either make a YouTube video on it or I will make a podcast episode on the topic. I am very passionate about treating skin of color. This is what I do in the office. So I would love to help educate you guys so that you can prevent half of the things, actually most of the things that I see in the office. So my specialty is treating the complications, but if I can educate you so that you don't get the complications, then you don't have to come see me in the office and spend too much money. Okay. So I hope that was helpful. If you want to follow me on social media, my handle is Dega Fangat MD on TikTok, Instagram, and on YouTube. And my practice is Delight Medical and Aesthetics in McLean, Virginia. We're in the DC area. So stop by if you need any help with some of the complications that I mentioned today. I hope you have a great day, and I will see you on the next episode. Bye.